Hi guys, Rob here and welcome to week 17 of my quarantine lockdown here in the Philippines. This week I had a chance to speak to a couple of nurses who work in the COVID-19 ward of a local hospital here. They have some really interesting stories to tell, and I think it's important that everybody watches this. Not only that, I'm going to look into the coronavirus stats for the week worldwide in the Philippines, as I do every week, and I'm also going to show this really interesting article in relation to death tolls in some countries. So countries like the Philippines, Japan, Taiwan, the death toll for the COVID-19 have been quite low, and there's an interesting theory as to why that's happened. There's lots to show in this video, so let's get to it. Hi guys, so I'm interviewing some frontliners or nurses here locally here in Cebu. First, I just want to acknowledge all their hard work that they do. Start off with your names, each of your names.
Hi, I'm May.
Hi, I'm Angelica.
Where are you from? Are you from what town?
We're the same town.
Which town?
We're the same. I'm from Lapu-Lapu City.
You're from Lapu-Lapu City?
Yeah,
Okay.
Lapu-Lapu.
And you're staying as a frontliner here in Mandaue?
Yeah.
Okay, so can you get home? Can you actually go home?
Actually,
We get home after work.
You can go home
Yeah,
before the
since,
pandemic.
yeah.
before the but what's the reason why you're staying in Mandaue rather than, is it so easy to get to the hospital?
Yeah, it's easy.
The
And
convenience.
it's very safety for our family.
Yeah.
So that they will not going to infect or anything. Because we are working in COVID area, so
Yeah. Oh yeah, so not going back.
Yeah.
Not going back.
Yeah, it's
So we're maintaining social distancing here. just to clarify that, social distancing. So you're basically staying here for the safety of your family because you work in COVID-19 type things. So getting to that, so how long have you been nurses for?
I started last year, November.
So 9 months?
I think
8 months?
8 months.
As a nurse.
Yeah.
And yourself?
I'm still a probationary, so I started working at the hospital since March.
Since March, okay. So what area do you work in the hospital?
I work in a COVID area.
COVID-19. And
I'm from COVID ICU.
so these are both from COVID-19 areas. Working there, how do you protect yourselves? What precautions do you take working in those
We're
wards?
always wash our hands every time. Yeah. We're going to disinfect ourselves also.
And when we're going to enter the patient room, we must use PPE. That's the very effective.
What is PPE?
PPE, the personal protection equipment. Yeah.
Okay, is that a full bodysuit type
Yeah,
stuff?
that one.
Fully covered up. So
Yeah.
okay. If for people who don't know, I don't know. So your role there is to look after the patients there.
Yeah.
Okay.
8 hours a day.
Yeah.
And now we're working 12 hours a day.
So you've gone from 8 hours a day to 12 hours a day.
Yeah.
Do you get extra pay for that, or a little
no.
bit? Not
No, just
not significant.
Yeah.
We don't have an assurance if we will get the hazard pay. That's
Yeah.
why.
You don't get hazard pay.
Because
The
outside
COVID-19.
hospital, yeah.
If you want the hazard pay, we must go look for it. They won't inform the HR or what, and then so if they will not know, we couldn't.
You can't get the
Sometimes
so
they see
so
our
basic.
hard work.
So let me get this right. Hazard pay is so you get your normal pay, but hazard pay is related to the COVID-19
Yeah.
because where you work, it's dangerous for you,
Yeah.
and you don't always get hazard pay. It's bureaucrat work, like red tape, so you don't get it always. Sometimes you get it, and sometimes you don't.
Yeah,
basically,
exactly.
but you're working like 12 hours a day.
Yeah.
Yeah, 12
How much strain is that on your body and your stress levels? Very stressed?
I'm very tired.
Sometimes we're lack of energy, but we have to work because they
No
don't
choice,
have
because
choice.
you're helping out this pandemic, so you're doing all the hard work.
Because that's what our profession.
Yeah, it's what expected, but you're doing it tough. It's not easy.
It's not easy.
Really stressful. How do you feel like you're respected in the community? Have you had experienced harassment?
I experience
Harassment?
not a harassment, being
Discriminated?
Yeah, because I am working in the hospital. They think that I am the one who bring those
COVID.
virus. Yeah.
So they think you've got the COVID-19 or you brought it into the area where you lived. Is that what you mean?
No,
So what you mean is they think you've got COVID-19 or you
No,
brought...
because they know that I am working in the hospital.
In the hospital, yes, yeah.
They discriminate because they think that I am the one who bring the virus or any. They just afraid of it.
They're afraid of you because they think you've got COVID-19.
Because we are working in the hospital.
Yeah, so they're scared of you.
They're really afraid.
They're afraid of you. So they treat you differently.
Yeah, that's
Just
very
discriminating
true.
against
that's
you.
discriminate that when the time they going to see you or look after you, they're going to avoid.
Yeah, avoid you because they're scared of you basically. They think you, because you're from the hospital, they think.
And it was also hurt for us.
What's that?
It was also hurt for us because we are working for.
You're
our
helping the
community.
people. Yeah, you're.
Then they didn't even give or some respect, even just a little.
Yeah, so that's one talking about respect because you're putting your lives on the line here, saving people.
We are putting our life and on the life of our family.
Yeah, as well. Without you, I mean, more people would die. So, and you take all the right precautions to cleanliness and protect yourself to not catch the virus.
Exactly, especially in riding a public transportation.
Yeah.
They're always looking at us. Oh my God, this is from hospital's uniform.
Okay, so you're in a hospital uniform.
Sometimes before when there is no buses, it's just a jeepney.
Yeah.
Sometimes the jeepney didn't stop.
So the jeepneys wouldn't stop you because you're in a nurse's uniform. So this is basically what they're helping with staying at hotels close by that you don't need to. Can you walk to your hospital? Is that what you do, or you still catch public transport?
No, we're not riding
because
You walk.
They buses for us to
get
ride.
our.
Oh, you haven't got a special bus.
Yeah.
So that gets rid of that discrimination.
But the hardship there is that you need to wake up early because you need to go because the
Or
bus
to
will
get
not
it
wait.
yeah, okay. So you need to all get it one bus at one time.
Exactly. So you will
If you
wake
miss that
up
bus,
3 a.m. in the morning in the dawn, and then you have to go late in the evening, 8 p.m. So it's more than 12 hours a day.
okay, because it's only one bus.
Yeah.
You don't have the choice of choosing what time. You have to go on that bus and that's it. And that's longer than 12 hours.
Yeah.
So after your shift, you have to wait
We're going to sleep in the bus.
because you're so tired.
It's very tiring.
Really tough, huh? This is really tough. So how do you feel about your role as a frontliner?
It was our pleasure to help our community, but what I really want is they also help themselves.
Yeah, so what are people not doing properly? What are people not doing properly then as far as hygiene? What do you see that's common they should be doing more?
They should
They should stay at home.
Yeah.
Stay at home?
And wearing masks.
Wearing masks?
When they're going out.
Whenever they going out or the malls.
And when washing hands?
Wash hands, just put some alcohol in their hands. Just
But
to protect
hand wash-
themselves also.
Hand wash at home.
Hand washing.
Yeah.
It's the most powerful.
The hand wash.
Yeah.
So washing your hands all the time,
Yes,
whenever you touch
exactly.
something, touch door handles, buying fruits or something, you should always wash your hands whenever you go out, when you're back. Okay.
And practice social distancing.
And social
also.
distancing, like we're doing,
Don't forget
like we're
social
doing here, social
distancing.
distancing.
Sometimes people they don't take the virus seriously. That's why.
So taking the virus not seriously.
Yeah.
And they catch it.
People didn't. Yeah.
They didn't take it seriously. That's why they're getting infected. It's okay because I'm washing my hands anyway. But you need also to
Social distancing.
promote social distancing each in every household.
So it's ignorance of people not knowing that the dangers of
Exactly.
ignorance has caused it.
It's
So-
because as I saw our patients, it's not really, it's not easy to look at them. They have
They're suffering the virus.
What's there?
They're suffering the virus.
They're suffering, but it's due to ignorance because they didn't know the seriousness of the virus. So
Exactly.
Because they don't know what's the virus real.
they don't think it's real.
They didn't take seriously about the virus.
Okay, so they
think it's just a
A joke
fever or what.
And do you find the demographics of the people, are they
Them is came from a rich family.
rich families
Yeah,
catching it?
Yeah, that's,
So-
that's what I
You can't
observed.
Because poor people can't afford to go to the hospital? Is that,
yeah, exactly.
that's why they're not in. So you're a private hospital, are you?
Yeah.
So you're going to get naturally more wealthier people coming in rather
Yeah,
than the
more
poor. So,
wealthy.
so that's probably why you see only.
Yeah.
Okay, so that makes sense. How's the general mood of your colleagues? Everybody's feeling stressed
Everybody's
and long
stressed,
hours,
yeah.
12 hours a day.
Yeah.
And what do you think can be
No
done?
I think always follow the government
What they say.
will, because the government only want the goodness of the community. That's why. But some people are not into the government's
They don't
will.
believe the government, what they're
Yeah,
saying.
that's
okay.
why they're going around. They're like they go outside without mask.
Yeah.
And without they go outside without a mask, and then they always keep talking because no one's watching.
Yeah.
That's why they only go to their homes when the time
The
it's-
police come or something.
Yeah, exactly.
They run into the homes. Nurses understaffed? Do you think you need more nurses?
Yeah.
You need much more.
We're really, like, are really out of nurses.
Stuff.
You're out short of nurses, so definitely more nurses. And a lot of resigned, huh?
Yeah, there is
No, it's-
many who
Who
immediate
resign.
Or
And
resigned.
some are infected, some are in home quarantine.
Okay, so because they're sick, they can't work as well. So, that's terrible. Yeah, and it makes it more pressure on you guys who are healthy. So,
Sometimes we can't go to our area because we have to run for the other area. That's why it's very hard and it's very
stressful.
yeah, exactly.
And you're risking your life as well.
Yeah,
You know, you could get this disease. So, look, kudos to you. So basically, the mood is down, stressed. You could do with more workers
It's not only the stress that we get; it's also the scars.
from the mask.
Yeah, because it's very tight.
Yeah,
It's very tight, and also
you
when
need
after
to protect yourself.
yeah.
it's get in
Your
the
full body.
inside
Yeah.
the suit. It's very hot and
Especially,
you'll get sweat.
Yeah.
And after you need to take a bath because
Yeah.
you need to parang disinfect yourself.
and you wear that bodysuit for like
And-
12 hours.
Yeah. And it's not good taking a bath after you get sweat.
Yeah, yeah.
Because it's very hot in the feeling, and it's like your body cannot adjust.
Yeah. Your hospital, are they from Mandaue or are they from all over Cebu or from
They
Cebu?
are sometimes in
Some-
Cebu City,
yeah,
Kapalapa
because-
and Mandaue.
Let's just say that this person is from Mandaue, but the hospital there is full. That's why they get into the
Transfer
other city
over.
to transfer. Yeah.
So you could get them from all over Cebu, the
Yeah.
province, Cebu City,
Yeah.
doesn't matter, just as, okay.
Some are from Bantayan.
Oh, you got Bantayan Island?
Yeah.
Wow, okay. Look, I want to have a look at masks now, just a quick question on masks. So this surgical mask is okay,
Yeah,
That's okay.
and what is it, the KN95,
Yeah,
the
it's more
KN95
safe.
is another one you use?
Yeah.
Now you have a video that you showed on how to use these masks. Can we just quickly look at that? It's not copyrighted, so it's okay. So this is how you put the mask on. Hopefully you can see that. So you're putting on two masks and you're putting a sticky on top.
That's
This
tape.
is what.
Tape to stop.
There's the first one.
So you
I
put-
put some key 95. It was key 95, and I put some tape
To
so that
stop
it
it.
was
for
So
air
that
getting-
they
yeah. here.
So this is what you do in hospital.
Yeah, that's what I do.
And then you put another mask on top of that.
Yeah. This one is the old. I just get the
Oh, the headband,
Yeah.
the head net or whatever it is.
net
Hair net.
PPE before I wear. Get PPE.
Oh, before you wear the full body,
Yeah.
and that's next. Oh, you put more tape over?
Yeah.
So how long does it take to put on the full kit that you wear? How long does that take to put on?
How long?
Yeah, the whole.
It was
For newbie, I think it took me
30,
10 minutes.
10 minutes to put on the full
Yeah.
suit,
Yeah.
including mask and all that.
yeah.
And after, What happens to the suit? Do you just throw it away?
No, we just dispose.
Dispose. So
After.
once you use that whole thing, you dispose of it and you have a new one. Oh, this is the suit. So this is the.
Yeah.
Let me see.
That's the super.
PPE to, no?
Yeah,
PPE 2.
What's it called?
PPE 2. The metallic color light.
Oh yeah. Okay.
And the PPE 1 is white.
So that one is extremely hot to wear for,
Yeah.
and you're gonna wear that like basically 12 hours.
Yeah. No.
Sometimes when we eat half of the
If
hour,
we
take it off
so
when-
6 hours wearing that suit.
And then put in.
And then, yeah.
So after
Then-
6 hours, you dispose of that one.
Yeah.
And then wear another one
Oh my
after
God.
eating.
Like how do you, if you're thirsty, need a drink?
We
You
don't-
can't.
We can't
We
drink.
can drink.
You can't drink for
if
6
you're
hours.
inside in the
Yeah.
COVID area. Because if you drink, you must need to
You take off your mask.
take off your mask.
So when you wear that uniform, you can't drink for 6 hours.
Yeah.
So if you're sweating and you need drink, you
Yeah,
can't. You have to
we-
wait.
Yeah, we can.
we
you have
can
to-
also pee.
You can't go to the
Yeah.
toilet.
Urinate. We can also urinate.
So you can't go to the toilet for 6 hours at a time. Do you have anything to say to people? Like, is there something you want to say to the public?
Please stay at home. It's yeah.
That's the
stay
best.
safe
That's the best.
and always
Yeah.
disinfect.
Always
Hygiene,
Wear mask.
Wear mask,
Every
yeah.
time
And
you're
follow
going
the-
outside.
social distancing.
Follow
Don't
the
forget
authorities.
to take vitamin.
Take vitamins
Vitamins.
and eat a
Home
good healthy
remedies,
diet.
Yeah.
Anything that good for your health.
Anything good, because these girls are really struggling to do this and they're doing it tough. So girls, what are you going to do after this pandemic's over? What's the first thing you want to do?
So since this is a new normal, so we're always putting ourselves into the we are going to stay safe and
Yeah.
stay healthy.
Yeah.
But this is a new normal, so
Yeah.
since this is a new normal, you need also to wear masks
So-
whenever.
Yeah.
I can't say that we're going to party
Yeah.
or something.
Travel or
Yeah,
family
we really
or
want to travel. Yeah.
hang out with friends.
My family.
I noticed a lot of Filipinos, one of the things they say is they like to go to church and send their
Yeah,
prayers. So
yeah,
that's another thing I've noticed with people after the pandemic is obviously unless we find a cure, we're going to be walking around with masks and washing our hands all the time.
Breathe the fresh air.
Yeah, well,
We can no longer smell the fresh air because we need to go outside with mask.
yeah, it's terrible.
Yeah.
It's a crazy world we live in. I just wanted to acknowledge their hard work that these frontliner nurses do in the COVID wards. It's extremely difficult. They work long hours, underpaid, so you need to respect them. And the best way for you to show it is in the comments below. Just put respect or thank you to these, so these nurses can see that you do respect what they do and they are helping the community here and doing a valuable job for Cebu and other nurses as well around the Philippines and worldwide. You've got the hardest job. You're the heroes here, and we should respect you for everything that they do. So please, if you can do that, so they can see that we as a community respect everything they do, their hard work. We have to acknowledge that. So thank you.
Thank
So-
you for being our voice.
Thank you.
Thank you for being our voice and
Thank you so much.
Thank you. Thank you. Take care and be safe. Take care and be safe out there.
So a big thank you to all those frontliners out there, whether that be in healthcare, police, soldiers, volunteers. You're doing a fantastic job during this really difficult time. As a foreigner, I can see the hard work that you're doing, and you're doing the country proud. So let's look at the coronavirus stats for this week.
So worldwide, it's itching up to 15 million cases with 612,429 deaths. Looking by country, USA is number one with nearly 4 million cases and 143,760 deaths. Brazil with 2.1 million and India with 1.1 million cases. With the Philippines, it's moved up again from last week to number 30. I wanted to look more at the low death rates of some countries like Japan and the Philippines. There was an interesting article in the BBC as to why the numbers were so low in these countries. The Tokyo University has done some studies to see how patients react to the virus,
and they found surprisingly it looked like patients had been previously exposed to a very similar virus and some immune system has built up already in the body. They think it's possible a SARS-like virus spread in the area before, not just Japan, but parts of China, South Korea, Taiwan, Hong Kong, and Southeast Asia, including the Philippines. Obviously there needs to be more research done, and it doesn't explain low numbers in some other parts of the world. It's interesting nonetheless. You can read more of this article on their website. Looking at the Philippines figures, the number of cases is up to 68,898. 43,991 are active cases and 1,835 deaths. The graph shown is not accurate though. The greyed out area at the end of the graph doesn't reflect the updated figures. So in fact the cases are not going down as portrayed by that graph. Looking at the central Versailles area, where I am, you can see the figures. Again, the greyed out area at the end of the graph is incorrect and not up to date. And the figures are not going down either. More closely, Cebu City has 8,155 cases, 3,265 are still active cases. Lapu-Lapu has 1,494 cases, and Mandaue City 1,510. I'll show more news next week as this video is getting too long.
Thank you so much for watching. Keep safe out there, and I'll catch you next time. Cheers.